Hotel employees have many jobs, but whether yours involves welcoming guests, cleaning rooms, or delivering meals, one thing is certain. You work hard to provide for yourself and your family. And this means more than bringing home a paycheck. It means full medical and dental coverage at a price you can afford. It means you, your spouse or partner, and your children are covered when you need a checkup or when you get sick. So when does this coverage start and how does it continue? It all starts with enrollment. You must complete an enrollment form to sign up for a Unite Here health plan. The form is mailed to you after 3 months of full-time work. It explains your coverage options and how much money each option costs. You will have a choice between 3 Kaiser plans and a PPO plan. All plans cover you and your family and include dental. One Kaiser plan is free, and the other plans cost only $25 or $50 a month. You can have this money deducted from your paycheck, or you can pay it directly to Unite Here Health. Remember, to get any of these plans, even the free one, you must fill out the paperwork and enroll in a plan. Once you enroll, the next question is, when does your healthcare coverage begin? There are 3 important pieces to this process. The first piece is the hours you work. When you work your required hours 5 months in a row, your employer sets aside money for your healthcare coverage. At this point, the money in your account is building. During the next 2 months, Unite Here Health processes your benefit information. We make sure we have all the information we need and the doctors have all the information they need to pay for your future care quickly. Coverage is the final piece of the puzzle. That's the calendar month when your health benefits begin. When you earn coverage for the first time, these 3 puzzle pieces come together. Simply put, you work 7 months, make any necessary payments beginning the 5th month, and your coverage begins the 8th month. Say you start working in January and keep working enough hours in February, March, April, and May. We process your enrollment information in June and July, and coverage begins the next month, August. Good for you! All your hard work is paid off. You and your family can start using your medical and dental benefits, and you now have life insurance. But what do you have to do to continue your coverage? Remember those 3 puzzle pieces? They come into play again. This time, you work your required hours for 1 month, wait 2 months for processing, and your coverage continues the next month. Let's go back to our calendar. The hours you work in June pay for your medical coverage 3 months later in September. The hours you work in July pay for your coverage in October, and so on. As long as you keep working and making your monthly contributions, your coverage continues month after month. If you don't work enough hours and you don't make a self-payment, you'll have a break in coverage. But as soon as you meet your hours requirement, your coverage returns. Let's review with an example. Maria, a new housekeeper, is hired in January. She works her required hours each month for 5 months in a row. Unite Here Health processes her enrollment information in June and July, and Maria's coverage begins in August. Now she can go see her doctor and take her son to get his teeth cleaned. Maria continues to work her required hours in June, and her medical coverage continues for the month of September. She works her required hours in July, and her coverage continues for the month of October, and so on. But hotel business slows in August, and Maria is short hours. She can make a self-payment by October 15th to continue coverage in November. If she doesn't, she will have a break in coverage for the month of November. Business picks up again in September, and she is able to work her required hours. Her coverage starts back up again in December. Like Maria, we know how hard you work, and we know how important medical and dental coverage is to you and your family. If you have questions about the number of hours you need to work, or your options if you don't work enough hours to get coverage, please call us.